this is an epidemic at this point. It's such a big issue that we wanted to bring in, well, the best. Dr. Daria Gillespie is an emergency room physician here in Atlanta, and you're also an assistant professor, too, at the University of Tennessee School of Medicine. So like I said, we had to bring in the best because we can't solve this thing, and this is very serious.
Yeah, it is, and there are so many questions out there. We wanted to answer a lot of your questions about the flu because we know so many people have them. First, we want to bring in Alicia Roberts because some people online, they are actually given an opportunity to ask some of the questions themselves. What are they saying, Alicia?
Yeah, Tracy, Sharon, Dr. Gillespie, we have been asking you all night to send us your flu questions, and I've been chatting with many of you for the last few hours online. The story is posted top of our Facebook page, so you can weigh in there if you've got questions for the doctor. It's what we're going to be talking about during this 9 p.m. hour, so make sure to like our CBS46 Facebook page. You'll see the story there, and then you can type your questions below. I want to get a couple of early questions over to the doctor right now, and these are some of the most common ones that we saw. Brenda writing in for us saying, what are the main symptoms you need to be looking for? This is a pretty common question. How do we know it's the flu versus a normal cold that we might experience this time of the year? Brian writing in as well, is this year's flu airborne? We've heard a lot of reports that the flu can spread just by breathing. Is that true? And how do we need to prevent ourselves from getting sick? Mary Ellis writing in as well. How long does it usually last, and how long is it contagious? This is an important question for a lot of you if you have kids. I know a lot of kids are, opting not to potentially go to school if the rest of their classroom is sick. Is this something we should all be thinking about? So I'm going to send it back over to the doctor, Sharon and Tracy as well.
All right, and so these are key questions, Dr. Daria. Why don't we take that first one? How do you know that you have the flu? So many people don't even realize that there's a test for this. It's just, the symptoms, and you guys are the experts, so you know.
Yeah, absolutely. And Sharon, that's a great question. And Brenda, who asked that, it's a very good question because it's really important to know the difference between just a regular cold or having the flu. I mean, a lot of people are starting to worry. I worry as a parent. I know all of our viewers are worried. So one of the key symptoms of the flu is an abrupt onset. Some people say, I feel like I got hit by a truck. It just hit me. High fevers, higher than 100 often, body aches, and then the chest symptoms. You get that cough, you have that runny nose, you may have a headache and sore throat, but it's really that body aches and just feeling like you got hit by a truck.
Yeah. And we've seen a lot of people, really wondering, should we be wearing masks because we feel like it's so contagious? Is it airborne? I mean, you can get it from someone coughing in your vicinity? How does it work?
You can't. So the flu is very, very contagious. And I know anybody who has children, my daughter came home from school the other day and she was coughing and sneezing. I think I could see the germs coming off of her.
We're parents too.
Exactly. And whether you have from your children or your coworkers or just somebody sneezing on you in the line at the grocery store, you can't avoid it. So sneezing and coughing is the chief way, but they are finding out a recent study showed that just breathing can spread it as well. And also touch. So somebody sneezes on their hand, they touch that doorknob or they touch that elevator button, and then you come back by 30 seconds later and you touch the same thing, and then not thinking, you rub your nose or scratch your eye or something, and now you've passed it on to yourself.
It almost seems unavoidable. Can you write us a note or something to just, maybe we shouldn't show up for a few weeks, right?
Hold on one second, yeah.
She's a doctor. Can you get it twice in the same season?
So you would not get the exact same strain twice, but there are multiple strains. People are hearing H3N2, H1N1, influenza B. What it means is there are a bunch of different strains, and you could get one and then get the second, which is why the vaccine covers multiple strains.
Yeah, is it just our lifestyle? Because we're all so busy, and I hate to say, a lot of people do not wash their hands like they need to. And again, when we talk about the kids, they're not washing their hands too, because we've seen it in other stories where it has to get into your body. What? Mouth, nose, eyes.
Exactly. Exactly.
I know. It gives us a shivers.
I know. It's so gross.
You do. Everybody watching, after this segment, wait until the commercial break, of course. Go wash your hands. Use hand sanitizer. If you're home, soap and water. But if you're out and you don't have access to soap and water, keep that hand sanitizer handy.
All right. Well, like we said, the doctor is in. Dr. Daria not going anywhere. You look like you could be an actress, but she has the credentials.
Thank you.
And she has the answers for us. So stay right there. Many more questions to come, Dr. Daria.
I'll be here.
She's here for the entire show. We're going to check back with her in just a little bit.